My name's Michael McKenzie. I am a radiation oncologist at BC Cancer Vancouver. Currently, I'm the co-chair of the Supportive Care Committee. It's a committee that fosters and runs trials that center on issues that are important to patients and families, specifically symptoms that they have. We're also looking at trials that support stress and other things that people experience when they go through the cancer experience. Radiation, just as chemotherapy, can be used to try and cure cancer, but it can also be used with the knowledge you're not curing the cancer, but to try and alleviate symptoms the cancer is causing. Basically, you can use radiation quite simply in as little as a single treatment to try and relieve that person's pain. And it's really quite gratifying because it often works. It often works with very little in the way of side effects. And when you alleviate somebody's pain, you get a big smile because it helps all other aspects of the person's life. And so it's rewarding even though we're not curing the person's cancer. Some of the trials we have done and will do will center on drugs and of course radiation therapy, important to me as a radiation oncologist, but also other interventions. So there's a trial we're getting going now that's not either a drug or radiation that helps support people who are experiencing stress. The biggest area we're excited about is to explore research using cannabis, and that's interesting because patients are keen on that too. There's an understanding that cannabis products can help with all kinds of symptoms, appetite, but also pain. But to what extent is that true? In what settings is it true? I mean, what mixture of different forms of cannabis is the right one? I think Canada is uniquely positioned to look at that. I can't really see how that's going to happen on a broad scale in the United States because of the regulatory framework there. In Canada, we're well positioned. We're hoping, we don't know where it's going to go, but we're hoping it can really make a difference for cancer patients in Canada and internationally because the CCTG does work internationally as well. So we're excited and looking forward to moving forward with the new agenda.